Oh, good morning. I want to thank everyone for being here today. First, I'd like to begin by acknowledging that we're here gathered on the traditional unceded territory of the Algonquin and Anishinaabe people. I'm pleased to be joined here this morning by NDP leader Avi Lewis, as well as Anthony Esposti, the co-chair of the Canadian Alliance on Mental Illness and Mental Health, and Vicki-Anne Rodrigue, the chair of CAMIMH's Public Affairs Committee. You hear from them in just a few minutes. And I would like to recognize that in a few days it's going to be Mental Health Week here in Canada. It's a time to shine a brighter light on mental health care, but more importantly, an opportunity to build momentum for real change. That's why this week I introduced a motion calling for the government to address the persistent underfunding of mental health services here in Canada. This motion calls on the government to adopt a national spending target for mental health services that is 12% of total health expenditures in Canada. It also calls on the federal government to work collaboratively with provinces and territories to achieve that very goal. In 2012, the Mental Health Commission of Canada published Canada's first and only mental health strategy. At the time, it estimated that mental illness was costing the Canadian economy at least $50 billion annually and recommended increasing mental health care spending to 9% of total health expenditures. More than a decade later, that target has still not been met. In fact, the latest data from the Canada Mental Health Association shows that only 6.3% of healthcare spending in Canada is directed to mental health services. This is well below what many Western countries spend on mental health, like France, which invests about 15%, and Germany at roughly 11%. Meanwhile, the cost of mental illness has grown dramatically. Today, it's the leading cause of disability, or one of the leading causes of disability in Canada, costing our economy $200 billion every year, according to the Mental Health Commission of Canada. We can reduce those costs by investing in mental health services so that Canadians can access care before they're in crisis. When people can't access timely mental health care, it affects their quality of life and places strain on emergency rooms and primary care providers. In the most tragic cases, it leads to preventable loss of life. And we know that mental health services, including early accessible community-based care, can reduce these pressures and improve outcomes. It's not just the right thing to do, it's the smart thing to do. Mental health advocates have called for an updated benchmark of 12% to reflect the reality Canadians are facing today. That is what this motion aims to do. Canada is experiencing a mental health crisis, and we can no longer accept a system where mental health is treated as an afterthought in our healthcare budgets. The theme of this year's Mental Health Week is Come Together, Canada. And it's clear that's exactly what we need to do to close the mental health funding gap and build a healthier, more resilient Canada. Mental health starts before birth. A healthy mother leads to a healthy child, and that early foundation shapes whether a young person can grow into a stable, resilient adolescent. From there, the link to the economy is direct. We are seeing high dropout rates in apprenticeships and early career pathways, often tied to untreated mental health challenges. And if we want a strong workforce, we need to support youth before they fall out of the system. And it doesn't stop there. For seniors, mental health is one of the biggest and most overlooked pressures on the healthcare system, driving hospital use, long-term care demand, and caregiver strain when supports aren't in place. This is a full continuum. If we invest too late and too narrowly, we pay for it at every stage. A life course approach to mental health, from perinatal care to older adults, is not just good policy, it's essential to economic and system sustainability. But unfortunately, yesterday, the Spring Economic Update revealed that the government plans to let existing federal mental health funding expire, meaning the funding gap is likely to grow in the year ahead. So today, we're calling on the federal government to recognize that mental health care is fundamental to a strong Canada and to adopt a spending target that reflects today's realities and commit to adequate long-term federal investments in mental health care. With that, I'm going to turn the mic over to federal NDP leader Avi Lewis.
Bonjour tout le monde. Thank you, Gord. Thank you to CAMIMH for joining us here today. And thank you for the vital work that you do every day to improve access to care across the country. In one of the wealthiest countries in the world, there are millions of people right now who cannot get the mental health care they need when they need it. Dans l'un des pays les plus riches du monde, des millions de personnes n'ont actuellement pas accès aux soins de santé mentale suffisants. When they reach out for help, they're too often faced with a bleak choice. Pull out their credit cards or wait in long queues for services that are stretched beyond capacity. We all know the profound consequences for those who are in need of care, for families, and for our communities. Sometimes it's a matter of life and death. When Tommy Douglas first envisioned public health care in Canada, he imagined a system that would care for people from head to toe. But in a country awash in wealth, that dream is still incomplete. Mental health is part of your health. It should be part of our public healthcare system, publicly funded for all. La santé mentale fait partie intégrante de la santé. Elle devrait être intégrée à notre système de santé publique. Instead, today mental health care is still treated as secondary. Too many Canadians can't access the support they need using their health card, not their credit card. The reasons are clear. Mental health services remain excluded from the Canada Health Act, and they remain chronically underfunded, leading to shortage of services, long wait times, and Canadians paying for health care out of pocket in the middle of a cost of living crisis. That's why I'm proud to stand here with my colleague Gord, a true champion for mental health in the House of Commons for years. Gord has consistently pushed the government to make meaningful policy changes to improve access to care. That includes his work on Bill C-201, which addressed the systemic exclusion of mental health from our universal public health care system, as well as this new motion that he's introduced this week. This moment speaks to our priorities as a nation. It's a time of nation building, of doing big things to make our country safer, more stable, and more independent. And here we have a human crisis that touches every family in Canada, and a set of long-standing evidence-based solutions that Canadian health professionals have been calling for decades. Truly comprehensive public mental health coverage is a nation-building project worthy of the term. Il est temps de définir nos priorités en tant que nation. Un financement public complet pour la santé mentale est un projet de développement national essentiel dont nous avons besoin dès maintenant. We've seen what this government can do when it decides that something matters. Last month, this government announced it had met a defense spending target that was set about a decade ago. But it still hasn't met a target for mental health spending that was set as far back as 2012 and was understood and called for many, many years before that. And if the current federal funding is allowed to expire in the coming year, as we think is likely, we will fall even further behind. The question isn't whether we can afford to act. The question is, why haven't we? Today, we're calling on the federal government to treat mental health with the urgency it demands, because healthcare in Canada should truly cover every one of us from head to toe. I'd like to turn the mic over now to our guests, and I'm happy to take your questions after.
So it's an honor to introduce our next speaker. It's Anthony Esposti, who's the co-chair of CAMIMH. Thank you, Anthony.
So CAMIMH is an alliance of 14 national mental health and substance use health organizations comprised of people with lived and living experience, their families, caregivers, and mental health providers. CAMIMH's mandate is to ensure that mental health and substance use health is placed firmly on the national agenda so that the people in Canada in need of support and their families receive timely access to equitable and inclusive mental health and substance use health care. As a mental health and substance use health coalition, CAMIMH is thankful to MP Johns for tabling this important bill. It is imperative that all parties come together to achieve mental health parity, which will help address the systemic issues contributing to the deepening mental health and substance use health crisis here in Canada. As one of the leading national alliances in these fields in Canada, CAMIMH has been consistent on one core issue: parity. parity in funding between mental health, substance use health, and physical health care. In June 2021, CAMIMH released From Out of the Shadows and Into the Light, Achieving Parity in Access to Care Among Mental Health, Substance Use, and Physical Health. It was a report illustrating the need for parity in access to care and what steps the federal government can take to achieve this. There is no health without mental health and substance use health. Until they are treated on equal footing with physical health, the system will continue to fall short. The latest evidence reinforces this. In January 2025, CAMIMH released its third annual national report card, and once again, Canadians delivered a clear and concerning verdict. Both federal and provincial governments received failing grades in meeting mental health and substance use health needs of the population. 6 provinces and the federal government were graded an F, with only marginal improvement noted. At the same time, 9 in 10 Canadians say timely access to care is important, and a strong majority believe government must do more to expand access to services and providers. The statistics are revealing. In any given year, 1 in 5 Canadians will experience a mental health concern, and by age 40, approximately 50% of the population will have experienced a mental illness. Almost 4,500 Canadians die by suicide each year, a tragic and largely preventable loss of life. Action must be taken. I will now invite my colleague, Vicki-Anne Rodrigue, Chair of CAMIMH's Public Affairs Committee, to continue in French.
Merci, Anthony. Plus du tiers des Canadiens et des Canadiennes indiquent que leurs besoins en santé mentale ne sont pas comblés ou ne le sont que partiellement, les services de counseling et de psychothérapie étant parmi les moins accessibles. La maladie mentale coûte plus de 200 milliards de dollars par année à l'économie canadienne, avec des projections à long terme atteignant 2,5 billions de dollars. Malgré cela, l'accès aux soins demeure inégal, difficile d'accès et fragmenté, trop souvent déterminé par la région, le revenu ou la capacité de naviguer dans un système complexe. L'Alliance canadienne pour la maladie mentale et la santé mentale publiera la nouvelle édition de son bulletin dans les prochains mois et, selon ce que nous observons actuellement, sans une action fédérale décisive, nous ne prévoyons pas d'amélioration significative des résultats. C'est pourquoi nous mettons l'accent sur une solution fondamentale, légiférer la parité. Dans le cadre de notre mémoire prébudgétaire, l'Alliance canadienne pour la maladie mentale et la santé mentale a demandé au gouvernement fédéral d'introduire une loi sur la parité en matière de santé mentale et de santé liée à l'usage de substances en tant que complément à la loi canadienne sur la santé. Ce n'est pas symbolique, c'est structurel et c'est aussi une politique économique solide. Cette loi permettrait de garantir que la santé mentale et la santé liée à l'usage de substances soient financées, priorisées et accessibles au même titre que la santé physique, avec des mécanismes clairs de reddition de comptes et de résultats. À l'heure actuelle, les soins sont offerts dans un système fragmenté. Les investissements sont inégaux. L'accès est incohérent. Les résultats varient considérablement d'une région à l'autre. Cela ne correspond pas au principe d'un système de santé universel. La législation sur la parité fournirait le cadre national nécessaire pour harmoniser le financement, améliorer l'accès et garantir que les Canadiens et les Canadiennes reçoivent les soins dont ils et elles ont besoin au moment où ils et elles en ont besoin. Sans cette base, nous continuerons de voir les mêmes résultats. Des listes d'attente, des lacunes dans les services, des besoins non comblés et des conséquences évitables, y compris des pertes de vie tragiques. La parité doit passer du principe à la politique. Et l'accès aux soins en santé mentale et en santé liés à l'usage de substances doit devenir une réalité et non une aspiration. And I'll say that in English. Parity must move from principle to policy, and access to mental health and substance use health care must become a reality, not an aspiration. We thank MP John's initiative and support in tabling this bill. Thank you. Merci. Miigwech.
I'd like to thank Avi for joining us here today. I want to thank Anthony and Vicki-Anne and all of CAMIMH's members, and especially their staff, and the people working on the front line of this crisis, doing life-saving work. It is time for the government to listen to their call to action and support the critical work they're doing in helping support all Canadians. Now we'll take questions.
Ask you about the in the Liberal platform in the election, there was a permanent youth mental health fund. Where are things at with that, and as far as you're aware? And it's an open question.
Well, it's something we push for. We push for direct funding for community-based organizations, and the government created the Youth Mental Health Fund, starting with youth. But right now, it's only a short-term commitment. It is not long-term, and we're looking for them to expand that. Make mental health care part of our healthcare, universal healthcare system. You break your leg, you go to the hospital. It's an insured benefit. But if you need help and you need counseling or services to support you when you're under mental health duress or you're dealing with a substance use related issue, often you're given, you're put on a wait list. And this has to change. There's not a family I can think of that I know across our country that hasn't been touched by a mental health episode or someone living with a substance use disorder. It's time for the government to act. 89% of Canadians want to see mental health be an insured benefit and covered under our universal mental health care system.
And maybe for you or for Avi, there's a national conversation right now in the government as it's looking at its online harms bill is considering a ban on social media for kids. Manitoba Premier Walt Canoe is looking into this as well. I'm just wondering where conversations are at with your party about whether you support this and what you think about that.
Thanks for that question, Mark. The details will be very important. Right now, it's a broad proposal. We have some pretty serious concerns about how it would be rolled out. The question of age verification implies another massive data grab for big tech, and it doesn't get at the fundamental issue, which is that the business model for social media is to extract our personal information and all of our movements online. And it's based on and it's ironic to be talking about it, or not, maybe it's not ironic to be talking about it in the context of mental health. The business model is one which is based on an addiction relationship with social media. Who among us has not thought, well, maybe I'll just check my Instagram before bed, and an hour and a half later, you're an hour and a half less sleep, you feel wrung out, there's nothing of value that's happened, but the technology has worked perfectly as it was designed. Social media is part of the mental health crisis affecting this country and this world, this moment of history, and we're concerned to protect our kids for sure. First of all, they're not the only ones who need protecting, and we're concerned that you can't fix the symptom by giving big tech access to even more personal data, and that goes well beyond the youngsters. It goes for all in society. So we're having an important conversation about this, sparked by these proposals. We're going to come up with a full policy position on it, but there are massive concerns in the way that age verification could take place, including which companies would do them. Does the government have an actual public option for age verification on social media, or are the tech billionaires behind Donald Trump going to be the ones who are extracting even more data from Canadians? All of these questions are still unanswered.
C'est juste sur la position de votre parti par rapport à cette idée d'interdire les réseaux sociaux pour les enfants.
Oui, le politique, c'est en développement. Dans les discussions sur les spécifiques, mais il y a des concerns profonds sur la question de vérification de l'âge. Et si le modèle d'extracter les fiches personnelles, les data personnelles, c'est va emplir avec un système de vérification de l'âge. Et si les big tech, les broligarchs, les amis de Trump sont les extracteurs de ce niveau de data, c'est un concern.
Ask you about the government's intention to sell off airports to private buyers. It's something they've spoken a lot about this week, and I want to know if that's something that you think is a good idea.
Absolutely not. I guess I'll shock everyone by saying that privatization doesn't benefit the public purse, except in the short term. In the long term, it can be a risk to safety, especially in essential infrastructure like airports. Workers always pay the price in privatization schemes, and the public always ends up paying more in the end. Whether it's privatization of garbage or privatization of parking meters, history is littered with examples of the failures of privatization, and this is a potentially a very costly and dangerous plan for short-term revenues that remove accountability for some of the most important pieces of critical infrastructure in Canada. We're absolutely opposed.
Just on a follow-up to that, when you're talking about those revenues, the government is signaling their intention to use those revenues as a part of their way to finance their sovereign wealth fund. So do you think that's how they should be going about it?
The proposal is getting worse and worse as you describe the details. A sovereign wealth fund should be, the models of sovereign wealth funds that the Prime Minister has been referencing, like Norway, are the complete opposite of the sovereign wealth fund that he's actually proposing for Canada. He's talking about selling public assets to put public money into a fund that is going to subsidize profitable private projects that are done in the so-called national interest, as opposed to taking a fair level of taxation, as Norway has, from finite resources and creating a fund over time that supports our social safety net and that supports a transition away from fossil fuels. There's just like the invocation of Norway is an indictment of the Prime Minister's way of doing this plan, and I don't know why he chooses to reference it, because the Norwegian Sovereign Wealth Fund is exactly how it ought to be done, and the Sovereign Wealth Fund proposed this week in Ottawa will be yet another subsidy for already profitable corporations.
As a British Columbian, would you be interested in running in Jonathan Wilkinson's seat, which is going to open in North Vancouver as he goes off to the European
Ian, I'm sorry you missed the last scrum where I made it clear to Mark that I will not be running in by-elections in Beaches East York or in North Vancouver or in Rosemont-La Petite Patrie, for that matter. This, as I've said a bunch of times, we have 5 spectacular caucus members who are punching above their weight here in Ottawa, piercing through the news cycle and through the House of Commons, which is dominated by the other parties. They've got that work covered. I have 338 other ridings to get us election ready in, to find candidates, to raise money, and to be ready for the next election whenever it comes. And our caucus and our base has asked me to keep traveling the country and being with Canadians in this moment of extreme hardship, when big decisions are being made about the direction of this country. My work right now is out there in Canada, and respectfully to you all, not here in the bubble.
In case you change your mind.
Yeah.
Est-ce que c'est parce que...
Non, mais
juste pour revenir à la même sur le même thème.
Sur le même thème de votre... en fait, de votre refus de vous présenter là, dans North Vancouver, pourquoi ne pas tenter votre chance dans cette région que vous connaissez bien?
Ah oui, c'est près d'où j'habite maintenant, mais mon travail maintenant est de voyager partout au pays pour mettre le parti dans une fondation solide pour la prochaine élection. Et j'ai une demande de mon caucus, de la base du parti, de faire le travail d'encontrer les Canadiens et Canadiennes dans le pays et pas ici à Ottawa pour ce moment. Et le parti doit être prêt pour une élection avant que je vais chercher un siège.
Est-ce que M. Wilkinson est une bonne nomination, selon vous, pour le Canada à l'Union européenne?
C'est tellement intéressant que les champions du climat partent le gouvernement comme Stephen Guilbeault et Jonathan Wilkinson. Ils parlent de cabinet et puis ils parlent le gouvernement. Et pour moi, c'est la vérité sur les intentions de ce gouvernement, sur le fiche, l'enjeu essentiel, le défi de changement climatique. Ce n'est pas une priorité et les champions se va à l'autre poste.
Last part in English? Can you just say that last part in English?
Yeah, I think it's really telling that the climate champions in the Liberal cabinet and the Liberal caucus have been systematically fleeing the ship. Stephen Guilbeault and Jonathan Wilkinson have been well known for climate advocacy within the government. I have my own quibbles with various positions they've taken on various issues, but they have clearly represented climate leadership in Liberal terms within the Liberal Party. They've left cabinet or been removed. They are now leaving office. And I think that says all you need to know about where climate sits in the range of priorities for this government, which is nowhere visible. And I think that if I were a Liberal climate champion, which obviously I would never be and will never be, but if I was a climate champ within the Liberal Party and within the Liberal government, I might be looking for work elsewhere too.
So on mental health. About getting back to mental health.
Thank you, Rich.
There's a committee of the House of Commons that's currently deliberating the temporary federal ban on medical assistance in dying where the sole underlying condition is mental illness. Obviously, the NDP has fallen below the threshold for committee representation. But have there been conversations within your caucus, and will your caucus be coming out with a position as to whether this ban should be extended indefinitely or made permanent?
Yeah, we are going to discuss that as a caucus, and thank you for that question. I think the question of Made in Canada has been the subject has been refashioned recently as we see people choosing Made out of desperation. And I think that for people with disabilities, I know the disability community is deeply disturbed, a community that lives in legislated poverty with an insulting $200 a month disability benefit. And despite the much vaunted changes to the application process for the disability tax credit this week in Ottawa, it's still way too hard. The disability tax credit is still connected to the disability benefit, and people are living in legislated poverty. People in mental health crisis should be getting the supports that they need. Mental health is part of your health. It has to be part of our universal, publicly funded health system. If people are choosing to die, because they can't get supports that they need in life, something is broken in our system. In terms of the particular bill and proposal, the ban and its extension, that's something we'll be discussing in caucus.
There are over 130 Palestinian students from Gaza who were accepted to about 26 Canadian universities. The government and the situation right now remains in limbo since their visa applications have still not been approved. Heather McPherson spoke, and she mentioned this as well in the House of Commons. She told me that this was a result of anti-Palestinian racism. Do you agree with her assessment, and where do you think the racism lies, within the government or anywhere else?
I absolutely agree. I stood at this podium earlier this month to call on the government to allow these brilliant young students, all of whom have admissions, many of whom have scholarships. They represent a bright future for Canadian scholarship, and they have managed to apply for postgraduate studies in Canada and been accepted. They've applied from the rubble of a society which has been ground to dust in an ongoing genocide. It is scandalous that the government of Canada is creating extra barriers or even insisting that they get biometric elements of their applications in Gaza, which obviously has no capacity for those services. When we accepted a vast number of refugees from Ukraine, all of those rules were made more flexible, or many of them were for many, many applicants, and we're calling on the government to do that for these students from Gaza. I will say something that I haven't said publicly before because you're bringing the issue up again. I raised this with the Prime Minister directly when I met with him. And I will say that he responded in a human way with a sense of concern. And I would like to see that human impulse of basic fairness and not just out of charity or compassion, but out of interest for the future of the knowledge base of Canada, of the important research that these students can contribute to here, not to mention the fundamental human rights that they have to move freely in the world and to pursue their studies here in Canada, for the government to actually do something about this. This can't be another issue that's brushed under the rug. Anti-Palestinian racism is why there are double standards in these policies, and they must stop.
So who's expressing the racism? Is it the government itself? Is it the Minister of Immigration? Is it the bureaucracy?
I think when we're talking about racism, reducing it to individuals or to specific agencies, it just doesn't get us anywhere. When you talk about racism, whether it's anti-Black racism or anti-Palestinian racism or any form of racism, including anti-Semitism, these are embedded in systems. And racisms have to be dealt with in systemic ways. I think the value of calling it out for what it is to highlight the double standards that we see.
I can. Oh, go ahead.
This is an interesting question. Do you agree, since you might have issue with the federal cut on the gas tax, do you agree with Alberta's provincial government's decision to keep their provincial gas tax?
I mean, I think that tax cuts just manifestly do not resolve the crisis of the cost of living. And I think that we've seen whether governments grab the revenue or they reapportion the revenue, it's just a very expensive and inefficient way to deal with the fact that the cost of living is out of control.
Back in 2021, we saw the Liberals campaign on permanent mental health transfers to the provinces. That turned into a 10-year agreement. We've seen plenty of piecemeal mental health supports are rolled out here and there. As recently, Secretary Vancouver did, talking about the $6 million fund for athletes. Given that basically everyone in the room above us would agree that mental health is health, why do you think there's really not that much motivation, it seems, on the government's end to put permanent mental health funding into the health formulary?
This is an excellent question, David, and it boggles the mind that we are doing nothing about this crisis when it's costing society so much well-being, destroying so many lives, and costing so much economic activity and productivity. Mental health is part of our health. It's the ultimate post-partisan issue. When you have an issue that everyone from the corporate giants like Bell Canada to everyday families at the kitchen table, every level of government, every party is touched by this. Everyone recognizes there's a mental health crisis in Canada. It's getting worse because of the invasion of social media and digital surveillance in our lives, the speed of life, the terror of living in these times when the world seems to have come unglued. This is an easy fix. It's been committed to year after year by government after government. The economic benefits alone, I don't want to reduce this to an economic issue solely because it speaks to all of us as human beings, but the economic benefits alone are for every dollar that you invest in mental health. You get $3 in economic return in increased productivity and economic activity. This is something, these investments will save our economy vast amounts of money and restore a sense of well-being for so many people who are suffering unnecessarily. I cannot make it make sense. This is a fundamental part of being Canadian. We have to put mental health in our public healthcare system, fund it adequately, and we need it now more than ever. And every member of every government that has pledged to do so and is failing to do so should be ashamed.
Comes down to what it would overall cost the public purse to include this in broader healthcare, especially considering going to a psychotherapist. That's about $150 to $200 a pop for one session.
No, I don't. I don't think that it's a simple question of math because everybody in the policy world and in government knows that the math is clear. The investments pay for themselves many times over. I think we're trapped in a story. And I think it's something, as a former journalist myself, I think all of us have a part to play in changing the story about what costs money, that is legitimate, that we say is fine, and what we spend our public resources on, and what is socially acceptable. I don't understand why there isn't a public outcry in this moment when the government seems to have untold resources for major projects, for weapons and war. And when we leave the mental health funding for Canadians aside in every conversation, If I were back among you in my role as a journalist, I would want this brought up in every single press conference, because it speaks to our priorities as a nation and who we are as Canadians. And so I think it's on all of us to make issues like this the burning issues of the day. And I think that, you know, like every other issue, I think about the chiefs from the Mikisew Cree Nation who were here at this podium a couple of weeks ago talking about the unbelievable rates of rare cancers affecting 20% of their communities from living next to the tailings ponds from the oil sands. Again, medicine and health crisis that's been understood for decades, where evidence-based responses have been suppressed. What is the priority in our country? What do we think is worth spending money on? Do we only think that it's worth spending money on projects that have incredible lobbying power, that have friends, powerful friends in cabinet, that have huge industries that benefit from them? Those are the projects and the spending priorities that we see going forward in this country, and the ones that benefit all of us, that make sense, that are based on decades of good evidence and science, get left aside and left out of the conversation. Mental health is foremost among them.
Est-ce que vous en avez parlé avec le Premier ministre?
I think I'm just getting the...
Got something to do.
Est-ce que vous en avez parlé avec le Premier ministre, ouais, de la santé mentale, du financement?
Non, jusqu'à ce moment, non. Non. Il y avait une conversation, c'est tout. Merci tout le monde. Thank you.
Thank you. This concludes the press conference. Merci, c'est ce qui met fin à cette conférence de presse.